Hi, we're here to give some feedback on the surgeries we just did. We did these about a week ago. You might recall the first patient probably had something called endometriosis. Second patient probably had something called an ovarian dermoid. As so happened, we were right. And I'm just going to explain a little bit about what we found and what we accomplished. Endometriosis is a common disease that affects a lot of women. Our first patient did in fact have endometriosis. Endometriosis is graded on a scoring system. I won't go into it too much. But if you look at the little hand-drawn notes we make, you can see mild disease has a little bit of ink. Severe disease has lots of ink. One way to think about it. Our first patient had a lot of ink. You can see here's a drawing of what we found. The good news is we were able to get rid of much of this disease, free up her tubes, make sure they were open, and get her all tuned up so that she is A, out of pain, but B, has much greater fertility potential. As is usual, everything went very smoothly. She went home a couple hours later, and I just saw her here in the office. She looks great, and we're talking about future plans. Due to the amount of disease she has, they may go straight to in vitro fertilization at this point, but at least they have options, and she's in a much more comfortable position to take care of it. Our second lady did have a dermoid cyst in her ovary, and as is fun to show, had some teeth in it. These are benign tumors. We were able to take it out, save the ovary, and once again, she was able to go home a couple hours later. She's doing great, and now we can move forward intelligently and effectively. So there's the debriefing of the surgeries we just did. A pretty typical day in the operating room here, and excellent outcomes as we usually accomplish. So thanks for your attention. We'll see you later. This is Dr. Wilshire, your Fertility Insider.